Thank you, Nikos, and thanks to Tony and Steve and everyone that organizes this fabulous course. It is a great honor to be up here. I don't know that I'm really qualified to tell anyone how to excel in vein practice, but I do think that I know how to succeed, and I'm going to make some points in that direction, I hope. Start with a fact. Technological advances have simplified venous treatment, enabling practitioners with no specific venous background to engage in the treatment of veins. Like it or not, it is a fact. The prevalence of venous insufficiency, another fact. Of the estimated 30 million people with symptomatic chronic venous disease, only 1.7 million seek treatment annually. So it is undertreated to a large extent. So the question today that I'm to answer, is there a pathway for novices to obtain the knowledge and expertise required to produce high-quality venous care? I believe there is, but it takes a passion and desire to obtain the body of knowledge necessary to perform well. Here's the start. This is the book, the Bible that we all should use, the Handbook of Venous and Lymphatic Disorders with the great chief editor, Dr. Peter Glavitsky. And if you attend the right meetings, and if you're lucky enough, you may even get your copy autographed by the great Dr. Glavitsky. Now, the next thing that I really want to touch on, other than learning the anatomy, physiology, pathophysiology, and treatment guidelines from Dr. Glavitsky and et al., is ultrasound. Those of us who did not train in vascular surgery or interventional radiology come to this field with a great deficit of knowledge in ultrasound, and that capability has to be improved in order to function at a high level. So although you're going to hear over and over again at this meeting that Dr. Nobropoulos is the master at ultrasound and no one can do ultrasound like he can, well, that's certainly true. I would not argue that. But that fact does not exonerate all of us who practice in the vein field from learning how to do good ultrasound, developing a good vascular ultrasound department in our practice. I have been fortunate enough to do that, and this is an image from a patient that we did 2 weeks ago or 3 weeks ago, a 40-year-old lady who's had a hysterectomy, followed 2 years later by oophorectomy, about 7 operations for endometriosis before her hysterectomies, colonoscopies. She's seeing gastroenterologists, several gynecologists, several surgeons, and suffers severely with all the symptoms of pelvic venous hypertension. And in our office, we were able to diagnose that she has severe nutcracker syndrome, as you can see, with severe compression of the left renal vein, and you see the IVC and the aorta and SMA compressing the renal vein. So even though we can't be Nikos, we all have an obligation to learn ultrasound and perform it well. Our patients deserve it. So there's a lot of initials and letters and credentials that can be obtained. I personally believe it's important to obtain credentialing. I wanted to be the most credentialed vein practitioner in my area. When I took this on, I think that's important. And as far as ultrasound, RPVI and RVT are needed. To become a diplomate of the American Board of Venous and Lymphatic Medicine is important. I don't think that makes you a vein expert, but I think that's part of your education to go through that process. IAC accreditation, yet to be seen, its utility or usefulness, it possibly in the future will be critical and maybe even more meaningful than it is now. Opportunities for learning are many and need to be taken advantage of. The vein meetings, when I first started vein practice, I became incredibly passionate about it. And I'm sure that all the brilliant and wizened vein experts that speak at these meetings got really tired of seeing this bald-headed old guy in the front row taking notes and learning all that I could. And anyway, I'm extremely grateful to all of them. And I encourage those of you who are starting out to attend the vein meetings, take the time, spend the money, and learn the knowledge that needs to be learned. The Journal of Vascular Surgery has a fabulous quarterly edition dedicated to venous and lymphatic disease, which all of us should have and read and study, which certainly I do. Become a member of the American Venous Forum, very important organization which I participate in, and I've got some bad initials there. It should be AVLS, American Venous and Lymphatic Society, as the American College of Pathology has changed its name to that. I am active in that organization. I highly encourage you to do so yourselves, again, for all the novices. So how to succeed? Most importantly, I think, is relationships. I know when I started out in medicine as a cardiologist, I had certain mentors that I admired, and I tried to emulate their behavior and learn specifically from them. I've done the same thing with vein medicine, and I think that these relationships are crucial to your development as a vein specialist and lead to friendships, which in the collegiality, which goes across different specialties and eras and age limits, and becomes extremely fruitful for your patients in terms of being able to provide better care. Industry support, I think, is important. It works, it's a double-edged sword. I think it can be very good to help you build relationships, perhaps participate in research and in pushing the field forward. But on the other side of the coin, industry support does not stop with learning how to burn a vein or glue a vein. You need to learn more about the field than just the technical aspects of doing procedures. A comprehensive approach is crucial when you start your vein practice. Please don't just learn how to ablate and go from there. What you need to do is learn everything. You need to learn sclerotherapy. It does you no good to burn a vein that's connected to large varicose veins in the mid-thigh that then occlude, thrombose, and make a patient miserable for 2 months. You've got to know how to do phlebectomy simultaneously or staged. You've got to know when and how to do it. You've got to know when and how to treat superficial venous disease, and also when to intervene and investigate for deep venous disease. So a comprehensive approach in all aspects of vein disease is the way to go. I think if you don't do that, you're missing the boat and you're missing a whole lot of fun. Very importantly, if you take on something and you already are in another specialty, another practice, and it's a full practice, you've got to give something up. I hear all the time about some of my colleagues that have a full practice in their specialty, and they decide to take on vein practice as a sideline, and so every other Saturday they line up 5 or 6 ablations and never give something up. You've got to give something up in order to make this work for you. You've got to take the time to attend meetings. You've got to read. You've got to learn. You have to develop relationships and devote yourself to the field. And I firmly believe that. And I'm going to conclude, my first conclusion is venous disease has a foundation of the best of the art and science of medicine. It deserves to be approached with the same humility and intellectual curiosity as when we first began examining patients as medical students. It's that simple. And I'll close with this great quote, which I think tells the whole message, from Hegel, a German philosopher from the Age of Enlightenment. Thank you.